Even by New York City standards, the community that St. Barnabas serves, the Bronx, is just getting hammered. A study published today by NYU found that across New York City, quote, to date, the Bronx has seen the highest rate of deaths per capita from the virus, which is really something for the good Americans who live in the Bronx. But it must be just utterly transformative for, say, the senior emergency medicine physician who's in charge of keeping people alive when they turn up in extremis at St. Barnabas Hospital. Joining us now is Dr. Ernest Patti, who's the senior emergency medicine physician at St. Barnabas. Dr. Patti, I know you've just gotten off work. I really appreciate you taking time to talk with us. Thank you.
Thank you for having me, Rachel. I appreciate it. Thank you.
I want to start by expressing my condolences. I know you and the team at St. Barnabas lost a colleague from coronavirus, Dr. Ronald Verrier, trauma surgeon, father of 3. I've been reading about him tonight. I imagine that that must make going to work even harder now.
It makes it very hard to go to work. It really does. When it hits home like that. I mean, when we lose any patient, it really bothers us. But when you lose somebody that you've worked with side by side, Dr. Verrier's even cared for my own family members, my uncle, my daughter. I mean, and he's a dear friend. It hits very close to home. Thank you.
Dr. Patti, you sent us footage today that was very affecting. Not because you showed us anything that was particularly gory or particularly narrative. You just gave us a point of view video showing what it's like in the clinical context to be among lots of patients who need mechanical assistance to breathe, what it's like to be a health worker in that environment, the sounds of that, the machines, the beeping, the struggling of the patients. It's something that we who aren't healthcare providers almost never see. I wanted to ask you, though, I know that St. Barnabas is not exactly a sleepy hospital under normal circumstances. I know you see something like 1,200 trauma patients a year. How does what you're doing now compare to what you normally see? How abnormal is your day in the life right now compared to a busy day in the time before coronavirus?
I have to say, probably 2 of the things that struck me the most right from the beginning, Rachel, were having to, when you walked into the department, the level of noise and the level of assault on your senses was just increased. It seemed like 100-fold. The number of machines that were beeping and alarming and making noise and trying to catch our attention was much greater than I've ever experienced in the past. And those would be the ventilators, because we had so many of them in the emergency department. We were basically running our own ICU down there, and we still are. Tonight, when I left, we were still running an ICU. The other thing is having to wear PPE or personal protective equipment like this for the entire day, nonstop. Because I can tell you today, I was actually performing an intubation on a very, very sick person who was COVID positive. And what struck me as I was going in to do the procedure was I thought to myself, I always say a little quick prayer, and I thought to myself, I hope this PPE protects me as well, because this guy I know is suffering so badly and is definitely infected, and I don't want to get sick because I need to come back here and work again and help more people. So those 2 feelings running through your head. And the other thing that bothers me as well is not being able to have family by the bedside when we work as hard as we are. Many times during normal resuscitations, families are present and they can see the level of commitment and dedication that we put into each one of our resuscitations. Here, the patients are alone. They don't know us. They can't really even see our faces because we're all covered with these masks and face shields and gowns and PPE. It makes it very hard for both the physician and the caregiver as well as the patient. It's unbelievable.
Dr. Patti, I can't tell you how much we appreciate what you do. I'm hoping, I'm putting another ask on you on top of everything else that you're doing, but I'm hoping that in coming days, you'll come back to us. We played tape from you earlier in the hour. You're talking about the hope that you're hoping that that the numbers are going to start to go down, that things are going to start evening out in terms of the patient load. We would love to talk to you in coming days as this proceeds in your hospital and as you and your colleagues fight this fight for us.
I really appreciate that. I'd welcome chatting with you, because let me tell you, sometimes being able to express what goes through your head, I mean, I can tell you when I drive home from work every night, I'm constantly talking to myself, to whoever the creator is, looking for answers, and it's tough to get them sometimes. And but I just want to remind you and all the viewers out there that this is a team effort. I work in emergency medicine. It's a team sport. It's not just one individual. I could not do what I do without the contributions of everyone that works in this hospital. Everybody contributes so much to help us get our job done. And you know, I have to applaud all of them. It's an amazing team that I work with.
And we all do. Dr. Ernest Patti, Senior Emergency Medicine Physician at St. Barnabas Hospital in the Bronx. I'm going to call you next week, sir. I hope you'll be able to come back. Thank you.
Thank you, Rachel. Stay healthy. Thank you.
All right. You too. We'll be right back.